Welcome to the Healthier Tech Podcast, the show about building a healthier relationship with technology. Now here's your host, R. Blank.
Today we're joined by Dr. Carl Rothschild, founder of Trifecta Light Technologies and a passionate advocate for red light therapy. With decades of clinical experience and a deep-rooted desire to improve lives, Dr. Carl brings both scientific expertise and heartfelt compassion to his work. Through his company's innovations, like the Trifecta Light Bed, he's helping to shape the future of wellness by making cutting-edge red light therapy more accessible. I'm really looking forward to this conversation. Dr. Carl, welcome to the show.
Thank you so much. I love having the opportunity to educate people about something that is very dear to my heart.
And as we were just talking about before I hit record, I appreciate having an expert come to educate me about red light, because as I was telling you, we've covered blue light, we've covered other types of therapeutic technologies, but this will be our first topic on red light. So you get a chance to really influence a lot of minds here.
My goal is to shock you.
Oh,
My goal
okay.
is to surprise you. So at the end, I want you to tell me if I succeeded.
Okay.
But I want to start off with 1972. And in 1972, I was a junior at Stony Brook University out in New York, which is a very good school. And I was a science nut. I was really heavily into biology and science in general. And I had won awards. I just loved it, but I couldn't figure out how, and I was a microbiologist as well. So I'm studying virus, I'm studying bacteria. And between me and you, it's boring. I mean, you're dealing with bugs. You don't have any way, I knew that I wanted to deal with people. And I get introduced to chiropractic. I want to tell you that chiropractic back in 72 was about 2 notches below voodoo. So it wasn't well respected. And so I was going against family. I was going against other people thinking I was out of my mind. But I had called chiropractors all over the country. And to the person, every one of them loved what they were doing. And that's what I wanted. I didn't allow money to be my focus. I don't mind making money, but if that was what I was shooting for, I don't think it would be very rewarding. What I wanted to do is I wanted to help as many people as I possibly could and have something that was fun to do. And so I became a chiropractor in 1978. And yes, I was having a lot of fun. I was helping a lot of people. Eventually, I opened 12 practices. And so I know how to open, manage, market, the whole thing. And so I liked all this stuff. Imagine you could do everything. You could educate, you could treat, you could do all these things. I loved it. But then about 28 years ago, which means I was about 20 years into my practice, I get introduced to red light therapy. And this was very early, and it was in its complete infancy of the industry and technology. And there was a medical doctor out of US. I'd moved to California, so I skipped that spot. And so there I was in California, and there's a medical doctor out of USC. He's a professor as well as an orthopedic surgeon. And I knew him for a couple of years prior to this, and he hands me a flashlight that's about this big. And it wasn't really a flashlight, but it looked like a flashlight. And he says, I want you to use this in your practice and help me save the world, so to speak. And of course, I thought he was crazy. And I'm thinking, yeah, I'm going to shine a light on people and it's going to make a difference. What are you talking about? But these lights were very unique. They were different. It was using certain elements of light that we hadn't experienced before. And I brought it into my practice and it made major changes. Now, this is with a device that is thousands of times weaker than what we're using currently. And yet, and still, I had some nice results. It wasn't as consistent as the results we have now. It wasn't as far. I mean, it was just fun. I mean, it was good. So I had this lady had gum disease. That guy had kidney problems. This guy had, because I was asking them, I said, I've been treating you chiropractically, but how about other things that you might not have brought up to me? Because as a chiropractor, I don't normally treat kidneys. I might not normally treat this or that, whatever. And they would bring those things up. And every one of those things we had very good success. This person's kidney function got better. This person's gum disease got better. And yeah, I was having a lot of fun with this. And then, so we're working, I was really working heavily on this equipment called, that was like these flashlights, but actually back then we called it cold therapy or cold laser. It wasn't literally cold, but the fact that the lights didn't get hot or the lasers didn't get hot, they wanted to distinguish it from the burning, cutting lasers. And so they used the term cold laser or cold therapy. And yeah, I was having a lot of fun, and the devices, as we were working with, we got the devices stronger, they were more effective. But then about 15, 16 years ago, it was discovered that there was an element of light, only red light, no other color, no blue, no infrared, nothing, red light, that could help with fat loss. And imagine, instead of freezing the fat, boiling the fat, lasering the fat, using radio frequency or ultrasonic cavitation, all of those are about killing fat cells. But this technology that I'm going to talk to you about doesn't do any of those things. And what they've learned over the years is that this element of red, only red, will actually help to change the fat cell wall temporarily. There's no damage, there's no injury, nothing. The fat cell wall becomes a little bit more porous and allows some of the contents to leak out to the surrounding tissues. And then with our protocol of using a few things like whole body vibration and other things, we help the body to move that fat away from the fat cells and eventually to the liver, where the liver will decide to either use it or lose it. It will either use that fat for whatever, or it will eliminate it from the body. And it worked. It works. And we were having fun. So now at that point, I'm thinking I'm going to get involved with manufacturing. I started manufacturing equipment. We were manufacturing pads. I was involved with lasers. We had, other people working with us with panels on the wall, and they had nice results. At the time, we thought they were incredible results. But then what happened is COVID hit, and our practitioners called me many of them called me and said, what do I think about coming up with a device that will allow much less contact between the patient and the provider? And we came up with a bed, because with the bed, you don't need staff. The patient could get in and out of the bed themselves. And we created that just to replace what we had been manufacturing up to that point, with no expectations other than, okay, maybe it'll do at least the same of what we were doing up to that point. And within a month of us having delivered the first series of beds, we realized that we were onto something. This was unbelievable. Things that we were getting feedback that were surprising. And what we have subsequently learned is when you bathe the entire body at the same time, not parts of the body, the entire body at the same time, that's when the miracles happen. And I know it's not very scientific to use the word miracle or amazing, but I don't know what else to tell you. Let me give you an example. Arnett contacted one of our providers, and the providers then called me and said, this guy's having a heart attack once, if not twice a week. And this heart condition has been going on for over 12, 13 years. And so every time he dies, the defibrillator that they implanted in his chest would zap him back to life. Now, what started at once a month and twice a month 12, 13 years ago had now, by the time we meet him, it's up to twice a week. And I don't think he had much more I never met the guy personally. I did interview him, but I don't think he had much longer to live. I mean, he was struggling tremendously. He would describe how just to walk a few feet was such a burden on him. He couldn't do it, and was so depressing to him because he used to be an athlete and now he can barely function. So I tell the health practitioner, I said, look, let's just treat him for 5 minutes. Now, normally a dose is 12 minutes. Let's just treat him for 5 minutes and stay in the room the whole time. Let's see what happens. Patient goes home that night, and that was about 2 years ago. He's had more treatment, but he's never had a heart attack since. And everything has come back to life. Everything is now normal. His pressure, blood pressure, his pulse, his energy, every organ and every gland has come back to life. And one of the things that he said in the interview, and I'll be sending you these videos that I welcome you to share with your audience. And one of the things he says is that what he didn't expect is that his energy would be absolutely through the roof, and that his erectile dysfunction is no longer a problem. And of course, he's not depressed. In fact, quite the opposite. He's a little bit out of his mind. And if any of you are ever interested in building a business and a referral business, which is the best, I mean, if you're getting patients or people into your clinic that you don't know and they don't know you, there's a whole intro process, which I'm an expert at. Chiropractors do have to know that. But it's much easier if they've been referred to you, because the patient comes in and they go, hey, Judy says you're the best. I'll do whatever you tell me to do. And that's what you're going to get with this type of technology, because I want to remind everybody, it's not satisfied patients that refer. It's excited people. And you're never going to see more excited people when they've come to you and they couldn't walk. Now they're walking. They were losing their eyesight and now they're not. And every organ and every gland and every tissue, I'm talking about so many different things: Parkinson's, dementia, Alzheimer's, multiple sclerosis, any autoimmune disease, kidney issues, diabetes, heart problems, which we already described, Lyme disease, which I'll talk a little bit more in a moment, skin issues. I don't care, head to toe, doesn't matter. And it doesn't matter how severe it is. We have seen unbelievably beautiful results with skin. That's why there are several divisions to this using this bed, because we're talking about the whole health industry, but also fitness, beauty, weight loss, which we already described, and then athletes. And I'm going to talk about, well, I could tell you about athletes right now. The reason why famous athletes have our bed is because if they use the bed in the morning or early in that day and then do their activity, whether it's a workout or whether it's a game, they're going to perform better. I had a guy call me up and say, and he's a very serious swimmer. He says, I can now swim almost twice the distance of what I used to be able to swim, just because of that red light bed, because it will bring you the stamina and the energy that you didn't have prior to that. And then they get in the bed again after their activity and they'll recover so much faster. The likelihood of them being injured is less, but if they are injured, the likelihood of them recovering faster and more thoroughly is extreme. I mean, I know I sound nuts. I mean, it almost sounds to some people like it's snake oil. In fact, I had a medical doctor who said, what you're talking about sounds like crazy. It sounds like snake oil. You're telling me it could help everything and anything. And I have to apologize to him and anybody else that feels that way, because when I tell you how this technology works, you'll realize that we're affecting potentially every cell in your body, whether it's nerve tissue, muscle tissue, brain, which is also part of the nervous system, doesn't matter. All of those can potentially be helped. So, like I said, you'll be hard pressed to find a condition that we couldn't help, including any musculoskeletal issue, ripped the tendons, joint problems, muscle problems, tendon problems. It doesn't matter. Sprains, strains, the whole thing. And then another category is neuropathy. So we have people that couldn't walk, or they can't sleep with a blanket on their legs because the weight of the blanket would drive them crazy. So they can't even have a blanket on them, and that stops. Neuropathy is one of the easier things that we have to deal with. So at any rate, as you could tell, I'm crazy about this stuff. And I'm going to go over with you in just a little while of what that mechanism. I talked about the fat loss, which is a separate mechanism, that it's about the light changing how porous the fat cell walls are just for a few hours. And then these fat cells go back to normal. But I'm going to talk to you about how the lights actually heal the body as well. But I want to talk to you about a couple of things. And I'm going to tell you about my book, but I want to tell you that I don't make a dime off of this book. In fact, I'm a lousy salesperson. I'm so interested in helping people. I wrote this book, and any profits that come from that go to charity. I wrote this book not to make money. I wanted to get people to understand the latest information about red light therapy. There are older books, This is the newest technology, the newest information, and it's called Illuminated Healing. So if you go to Amazon, you can get it as a book, you can get it as an Audible and listen to me for 8 hours or something like that. And you can also get it on the computer, so you can read it off the computer as well. So that's about the book. The other thing I wanted to introduce you guys to, there's 2 other things. One is the YouTube channel, which is phenomenal. It's I think over 160 videos now that are really first rate, beautiful videos. So if you go to YouTube and put in the @ this is the Panama Dogs show, is that what you have?
She was very excited about the information you're sharing. She was shocked.
So if you tell your dog if she it's a she, huh? So if she goes to
That one, yeah.
YouTube, you put in the @ and then Trifecta Light Official, and you'll see all these beautiful videos, really great videos. So that's that. Now, the last thing in regards to the website and whatever, I would like to introduce you and suggest that you guys go to the website. The website is Trifecta, like winning at the racetrack, Trifecta Light, Light.com, trifectalight.com. And if you go
and
there,
we'll have that link in the show notes.
and I'm
Please
going to be
continue.
sending you show notes as well, and the videos and links and stuff that you're welcome to share with your audience. If you go to the website, I want you to go to Contact Us page. And there are 3 parts to this Contact Us page I want you to become familiar with, if you want. On the left side of that Contact Us page is a way for you to learn where all the offices are that have one of these beds. All you have to do is fill in your information. Our staff will be working on it, find the closest, most effective location for you. And here's the challenge. I want each of you to try this bed 6 times, but only if you have an issue. If you feel great, I don't know if you're going to see a difference, but if you have problems, in fact, the worse off you are, the more dramatic the change will be. The worse off you are. So I don't care how bad off you are, get in the bed 6 times. Now I'm going to tell you something. In the 50 years they studied this technology, there has never been a recorded side effect. You couldn't hurt somebody with this stuff if you tried, number 1. Number 2, there really aren't any contraindications. You can get in the bed with electronics. You can get in it with metal, titanium, steel, blah, blah, blah. You can get in it with all those things. Staples, right after a surgery. If you get in the bed right after a surgery, for example, you're going to recover so much faster, and that will heal so much faster. And so the question begs the question of why isn't that bed in every OR or nearby every OR? Why isn't it in every ER or any emergency facility? Because the recovery will help you tremendously. And I'm going to tell you something. You being healthy doesn't make the medical profession a dime. And if all of us were so healthy, they would go broke. Thank God for that, as far as they're concerned, that there were so many sick people. And by the way I liken well-being and health is a candle that burns really bright from the beginning all the ways down to the bottom and then sputters out and dies. But that's not how it works most commonly in this country for a number of reasons. There's nobody out there spending billions of dollars to educate you how to take better care of yourself. Not. There are a lot of commercials, unbelievable number of commercials to tell you about the drugs you should take. I'm not against drugs. I'm not against surgery. I'm against the way sometimes it's used in this country, where that's the first thing that they think about instead of some alternatives. And I'm telling you, one of the greatest alternatives I have ever seen is get inside that bed. So moving right along, we go to the website. On the left side, we're going to find a location closest to you. And I want you to try this bed 6 times. And I want to tell you something. If you don't, you can't complain anymore. But if you try it 6 times and it doesn't make the changes that I'm telling you it will, then you can go back to complaining again. I'm kind of LOL here, but what I'm telling you is that after 6 visits, it is rare to have somebody that doesn't see any change at all. Now, if your condition is so severe, it'll take more than 6 visits to get even further along, but you should see something after 6 visits. So let's take Steve, for example, who contracted Lyme disease when he was 12. And it ruined his life. I mean, there were times, he couldn't have a career or his education. Everything was ruined because there were days when he wasn't sure he could get out of bed. And then he gets in our bed. He's 50-something years old. So 40 years later, he gets in our bed. And I'm going to send you that video, and I want you guys to watch the video. His name is Steve. And he gets in the bed, and he gets out of the bed, and he goes, I didn't notice any difference at all. And he just figures it's a bunch of junk. But there's more to the story, so I want you to watch that video. It's called Steve on Lyme disease. Watch that video and see if that doesn't shock you. Remember I told you I'm going to shock you as to how it could change his life from hell to whatever your version of the opposite, if you want to call it heaven, whatever. You got to see this video with him. But there are many other videos. There's Jessica that had 16 very serious conditions, including 20 years of only diarrhea, including also Lyme disease, shingles. She had 3 forms of psoriasis. She had heart problems, migraines, kidney stones, and one of the things she had was uveitis. Now that means that pressure in one of her eyes was over 180 when it should be 10 or 12, something like that. And so that if that goes unchecked and untreated, she'll lose her eyesight in that eye.
Mm-hmm.
So the treatment for that, if you can believe this, is an injection right into her eye. And I foolishly said, hey, what's that like? And knowing that, I figured she was going to say something that wasn't great, but man, it's horrible. And now I'm hearing that I didn't realize how common that is. There's more people than you might imagine getting injections right into their eye. And after just a couple of weeks treatment in the bed, everything she had wrong with her is gone, and she feels fantastic. The psoriasis, where she had a rash across her forehead, her ears were always red and bleeding. That stopped. So the only way you're going to learn about this is if you try it yourself. 6 visits. And then if you don't see any results, you can go back to complaining. But the likelihood of it not helping you is extremely slight. In other words, the likelihood of it helping you is high.
So this woman you just explained, that was a lot of different symptoms, and you've covered a lot of different symptoms, and you said you had some kind of understanding of what the mechanism, like I'm very curious what kind of mechanism could explain a healing response across so many diseases.
That was my goal, not only to shock you, but to get you interested in what in some ways is not the most exciting thing. You see, when I teach people, and I used to be an educator, when you teach somebody about the science, their eyes roll back and I'm trying to get them to not fall asleep. But now I want to pique your interest because this is important. You knowing how and why it works will get you to understand why it's so universal, why it works on so many different things that are going on with the body. So we talked about the YouTube channel. We talked about the book. We talked about the website, going to the Contact Us page and isolating on that left side of the page how you're going to find a location closest to you. One other thing. On the right side of that same page is the possibility of you thinking, well, maybe I should incorporate this into my business. Now, it's the entire health industry, fitness industry, beauty industry, the weight loss industry, and I already described athletes. In fact, we're delivering a bed very soon to Chris Paul. I don't know if any of you know Chris Paul is a very famous basketball player. And there are many other athletes like that that are using red light therapy to great extent. But it's still not huge. And again, in this country, United States, I know you're not here right now, but in this country, healthy people are not what the medical profession is looking for, because you don't make anybody any money. So the sicker you are, emergency medicine is unbelievably expensive and makes people.
Healthy people make insurance companies money. You'd think that might kick some capitalist incentive into
I
gear.
think insurance companies are in cahoots more with the medical profession than you think. I'm telling you.
No, I don't doubt you. I'm not a defender of the insurance industry. I was just
Now,
saying
there are things
economically.
called HMOs, and that's a little bit different. They make more money if they can save money by not spending. And in the one hand, so they don't go crazy with giving you every test in the world and all that stuff. On the other hand, when it's a PPO and they get paid by the service, period, then they will encourage all kinds of crazy tests and all kinds of stuff because they know they're going to get paid on it. I don't want to get myself in any more trouble than I'm already in. So we're going to leave the medical profession and insurance and the pharmaceutical industry alone just for a moment here. And let me talk to you about that right side of that page. Check it out. See if this doesn't make sense for you to incorporate. It costs around, what I heard is like $40 a day to have this bed. The kind of money that people are making averages around $20,000 a month. And so just think about it and incorporate that possibly in your practice or your business. Like I said, the beauty industry, the fitness industry, or whatever. So now let's go over the mechanism. How does this darn thing work? 50 years ago, they started doing research on this, probably a little bit longer than that. But they didn't understand exactly how it worked. And now they understand better.
Okay.
So there are a few words that I want to go over with you. One word is infrared. Now, a lot of you have heard that term, infrared saunas, infrared tables, infrared pads. Now, there's no such word as just infrared. It's either far infrared, which is about heat, or near infrared, which is the miracle wavelength, which is about healing. Heat is fun. Yeah, it's fine. If this was all about heat, I'd just throw you in a shower and say, that's all you need. That's not what this whole thing's about. So the far infrared, that's fine, but we're talking about near infrared. In fact, far infrared is a problem because heat and our lights don't get hot. Remember, we're talking about cold treatment. The lights don't get hot, but if they did, they would bring more blood to the surface of the body. That's why after a hot pack, someone's back is bright red. That's what we don't want. We don't want blood to the surface, which will block the penetration of the light. So the really high-end medical grade professional models, which cost more, don't get hot. So now let's talk about how it works. And then I'm going to talk to you about what you should be looking for in the top kind of equipment out there. So now is another word that I want to talk to you about, and it's called mitochondria. But before we go there, I want you to understand that your body is made up of tissue, and every tissue is made up of cells. And every cell, and that's all kinds of cells. You have brain cells, skin cells, heart cells, blood cells. These are all the cells that make up your body. And every cell has components. It has a nucleus. It also has the mitochondria. So what is the mitochondria?
The powerhouse of the cell.
Are you stealing my thunder? Is that what you're doing here?
No, it's like one of the things I remember from 5th grade. Mitochondria is the powerhouse of the cell.
It is.
Yeah.
All right, I'm done. Thank you very much.
Yeah, no, continue. No, so we now have identified mitochondria.
So the mitochondria is the reason why you breathe oxygen. It's the reason why you eat food. That combination creates this very important molecule called ATP. And the ATP is the energy currency of your body. If you have the right amount of ATP throughout your whole life, you will not get sick, even if you're exposed. Listen, why didn't everybody die from COVID? Why didn't everybody die from whatever diseases that are out there? And I used to teach a class which didn't go over well because I didn't have the chops. I didn't have the skills in my first year of practice. And I taught a class that had something to do with only sick people get sick. And of course, then I've got the whole audience going, what are you talking about? You mean a healthy person can't get sick? But the truth of the matter is that a healthy person might get sick, but they won't get nearly as sick as a sick person. So if you're already sick and now you're exposed to something, then you'll be able to succumb to that. And so the idea is to keep you as healthy as possible. And we already talked about the candle that burns bright from the top and the bottom. I'm 73 years old. And I'll tell you why some of you guys out there don't take care of yourself. And you know what it is? You're not scared enough. You haven't heard your 75, 30, or 80-year-old self crying in the background going, "What are you doing? Do you not understand that you think you're getting away with this?" But talk to me, the patients that would come to my office, that sometimes I would think to myself, please God, don't let me wind up like that. I wouldn't say it out loud, but they're the ones that scared the heck out of me because I got to see them at an older age and seeing what they've done to themselves. So who wants that? Where you can't function, where you're in a wheelchair, you're an invalid, where you can't feed yourself, you can't wash yourself, you can't even wipe yourself. Who wants that? You don't want that. Everyone says, well, I'm living for today. No, you're not. What you're doing today is going to have huge consequences when you're older. And it's not that difficult. I'm not saying stop everything. No more fun. You're never allowed to have fun. I'm not saying that. Just do better. Be better for yourself. You got to be better. It's corny, but it's about loving yourself. But also it's becoming aware of what are you doing to yourself. You already know what's not good for you. You know smoking, alcohol, fast foods, fried foods, they're not good for you. So if you're doing it a lot, do it less. And if you're doing it not that much, stop. Stop completely. I'm not bragging, but I got scared enough that I don't smoke. Never have. I don't drink alcohol. I don't eat foods that are not right for me. But that's just me. I don't have preservatives. I don't have any of that crap. But I'm scared enough. And if you're not scared enough, go get scared. Go work or play, whatever. Just check out your nearest convalescent home and say, maybe you can volunteer, whatever, and see what you don't want for your future. What don't you want for your future? And think about the percentage of people that make it past 80 and are vibrant and moving and are having fun and can think. Take care of yourself. And so there are 3 things that I tell you to do. There are 1,000 things, but let's keep it simple in the beginning. Eat smart, and that includes drinking as well. So consume smart, exercise smart. It's just 30 minutes, 3 times a week. That's it. And it's cardiovascular. So figure out when you go to YouTube, I would go to ChatGPT and find out what is the right pulse for you to be when you're active. And so what you want to get your pulse to a certain amount for as much of those 30 minutes as possible. So if you're resting at 72 pulse rate, beats per minute, it probably will suggest you raise your pulse, and this has to do with how old you are, by 30 or 40 points. But just try that. So 3 times a week, 30 minutes at a shot. You don't have to do it every day. Eat smart, exercise smart, and add red light therapy. So it sounds like I'm selling something, and I am. Health, well-being. But take it from somebody that I've experienced all of these things with tens of thousands of patients, watching what they've gone through and what you don't want in your life. So let's get back to how this thing works.
Yeah.
Mitochondria, the powerhouse of the body.
Yeah.
And it creates that ATP. And so if you're not healthy and your mitochondrial system is dysfunctional, then you will not be producing the right amount of ATP and you will suffer the consequences. That will lead to disease and eventually death. So you want to do everything you can to keep the ATP up as high as it can. Not higher than you need, not lower than you need, but what you need. And that's it's called innate intelligence. The body knows better than all of us what's right. It's just asking you to stop screwing up. So there we are with the ATP and how It's dysfunctioning. So how can we get the ATP, and in particular your mitochondria, to be doing its job the way it should? And what they learned is that it's sun and sunlight and some elements of sunlight that are beautiful to really capture and then focus it and then drive it into your body. What we do with our bed is we magnify these 4 elements of sunlight, drive them deep into your body, and affect as many tissues as possible. I'm going to repeat myself. It's about bathing the whole body. I don't have objections to a helmet, to a mask, to pads. They're fine. We make those. But we never got anybody telling me the kind of things that I've described, the miracles that we've seen. And those only happened when we bathed the whole body at the same time. So what they found is these 4 elements of sunlight, which is red. So we have 2 different elements of red light and 2 different elements of near infrared. That's the cold laser, cold therapy that I was talking about. Near infrared, not the far infrared, which is hot, the near infrared. And drive these 4 elements of near and red light, 2 elements of that, 2 elements of near infrared, and then drive it into the person's body, head to toe, front and back, left and right, inside and out, affecting as many cells as we can. And that's when the miracles happen. And that's the bottom line. Now, somebody might say, well, what if I just go out and sit in the sun? Now, the sun is like, if you have an itch and it's barely touching you, you need something stronger.
Yeah. Well, it's also not an option for me. I don't know if you can tell my complexion accurately through this, but yeah, I sitting out in the sun is not something I'm allowed to do.
Well, we want you to get a little bit of sun, no? Are you not allowed any sun?
Well, I'm allowed. I mean, I'm not an albino, but I mean, I'm as close to one as possible. So yeah, no, I have to wear like full coverage when I go outside.
Okay. Well, at any rate, so rather than do that, now, so getting back to the bed, it's not like a tanning bed. So you're not going to get tan. It's not going to affect you in a negative way. In the 50 years they've studied this technology, there's never been a recorded side effect. And as I already said, there really aren't any contraindications. The only contraindication out there, so like I said, you can get in there with a defibrillator, or a pacemaker, any metal, electronics, all that. None of those are contraindicated. The only contraindication is a legal contraindication. It's not a real contraindication. And that's a pregnant woman. Because if that baby is destined to come out abnormal, when it does, that couple becomes one of the most litigious people on the planet. And they're going to sue anybody that's in the neighborhood. And I just tell our people, you know what, let's not be in that neighborhood.
Yeah.
Even though in other countries where they don't have so many attorneys, they're using the red light therapy to assist in the mother's health and the fetus's health. And I just realized when I use the term red light therapy, it's always, when I'm telling you that, it's the integration of red and near infrared together.
Mm-hmm. But that's not what everyone, that's not what all of your competitors mean when they say it, right? That's what you
I don't know
mean.
what they think, what they're saying.
Okay.
Red light therapy could be whatever any company thinks it should be. But I wrote the book. I know this better than anybody. And red light therapy in general means the integration of red and near infrared. And some of the other high-end devices follow that same route. Now, there are some lasers that will only use near infrared or only use red. They don't integrate because they only have 3 diodes.
Mm-hmm.
We have over 5,000 diodes. So you're going to get a nice smattering of these 4 wavelengths that we drive deep into your body. And let me just tell you a story about this guy that was going blind. He had Leber's hereditary optic neuropathy. There's nothing that they can do for him other than to try to keep him out of some level of pain. So it was painkillers. But his eyesight was going because this disease is like multiple sclerosis of his retina, and it's eating away the retina. But by the time we meet him, he's half blind, give or take. It's approximately. So he has to use magnifying glasses. Besides wearing glasses, he has to use a magnifier. But he knows he's going completely blind. So we use the light with him. And what we were able to do, as we are with multiple sclerosis, is to halt the progression, stop it in its tracks. And we got rid of just about every other symptom he had. But we were not able to regain the eyesight he's already lost. So if you have that kind of a disease like MS or LHON, which is larger community than I thought it would be, then you want to get in using this bed earlier rather than later. So I'm going to tell you one more story. As you can tell, I'm the one interviewing these people. Now, I have a large company. I have a lot of staff and associates, but I like doing, I have all this experience as a practitioner and this experience of red light. So when I do the interview, I know where to come from, what questions to ask to find out how effective this has been and how it's changed his life, this person's life. And what we hear more than ever is, thank you for giving me my life back. And that's what happened in 1972. I wanted to do something where I'd be helping a lot of people and have fun. And this is the easiest thing I've ever done. And chiropractic, there are techniques that could take years to learn. Now, the only thing you have to learn with this bed is how to use this finger to press the on button.
Yeah.
Get in the bed, get out of the bed, and get out of the office. What could be easier? Years to learn a technique, which I'm not saying don't learn those techniques. I'm not telling you to not do what you do. Acupuncturists keep doing those, but add this wonderful modality into your business. Whether you're an acupuncturist, chiropractor, naturopath, I try with the medical doctors, but there's really into drugs and surgery. That's because there's more money with that. Red light therapy will make people a goodly amount of money, but one surgery can make somebody $20,000, $30,000. That's hard to compete with. And to give you an idea about drugs, one of my patients had ulcerative colitis, and nothing was helping them. They tried all kinds of cocktails and whatever and drugs, and so they used a biologic, which is a 1-hour drip into this guy's body. And take a guess 2 months later when he gets the bill for how much that 1-hour drip cost.
$60,000.
You just ruined my whole. No,
you said to take a guess.
Nobody's ever guessed more than like $5,000, and even that's outrageous, right?
Yeah.
But you're right. It's almost $60,000, 1-hour drip.
Yeah. Well, I have experience with the U.S. health system. So.
All right. But the next time I ask that question of you, here's how it goes. So take a guess. And you go, well,
I don't know, $38. Yeah.
Almost $60,000. Can you believe that? It's nuts.
I can.
And so how do you compete with that? When you can make so much money doing that, how can you get them to stop wanting to do that? It's actually unfair. Never mind ethics and morals and all that stuff. It's just unfair to put them in that position. You have a doctor that if he does a surgery, he makes $30,000. I'm making that up. I don't know how much he makes. A lot of money. Or not make a lot of money. I mean, the bed will make you $100 a treatment, give or take. It's just, it's a tough thing. I don't know what it's like in Panama, but in the United States, healthcare here is nuts.
Yeah,
but I've been faced with it for 50 years. I've been studying it and been involved with it. And everything I tried to do, I failed. When I went to practice, one of the goals we had was to get people to take less drugs, not stop. I love the idea of having medication and surgery.
Yeah, when you need it, it's really, really important.
Of course.
And incredible
but
invention.
It's abused so much.
Yeah.
So our goal was to have less drugs. And guess what? We failed so miserably that the drug intake with the pharmaceutical industry has grown outrageously. And guess what? I don't know if you have these commercials in Panama, but we don't have commercials that for over-the-counter stuff. What we have much more is you tell your doctor what he doesn't know because he's too dumb, that he should be prescribing this drug that we're telling you is better. So they are educating the patient to be able to teach the doctor who doesn't know what he's doing to prescribe the drug that they're suggesting. And you might think, well, I wonder if that works. Well, why would they spend billions of dollars in advertisement if it didn't work? Teaching the patient to force the doctor to give them the pills that are more expensive It's nuts, but whatever. Can only do
Well,
this as best we can.
Yeah, Dr. Carl, your enthusiasm and for red light is obvious. Just in what you talk about before you even get into the career and what you've done with Trifecta. I've certainly been educated by this session, and so everyone who's listening, the website again is trifectalight.com. And Dr. Carl suggested you go to the contact page, so we'll include that on the show notes as well. But that's where you can find a provider near you, and where you can find out more about the beds for your own business or your own home. Dr. Carl, thank you so much for coming and spending this hour and educating me and my listeners on red light. It's been such a pleasure learning from you and getting a chance to meet you.
My pleasure. And I hope we meet again, okay?
Excellent.
You take care.
Thank you so much for listening to this episode of the Healthier Tech Podcast. Remember to check the show notes for all the links and resources we mentioned today. If you enjoyed the show, please like and subscribe on Apple, Spotify, or on the platform of your choice. And if you're ready to take control of your tech environment, head over to shieldyourbody.com to explore science-backed tools that help you live a safer, healthier life in today's connected world.